So the REFLOW study was performed between 2015 and 2018 in 7 centers, 5 in Belgium and 2 in Germany. And we enrolled 120 patients which were treated with LEGFLOW over the wire system. So, and the aim of the study was to investigate the efficacy of the LEGFLOW in long task C and D lesions, and we evaluated the primary patency of the target lesion through duplex ultrasound. Most studies until now have focused on smaller lesions, which basically are lesions which you only encounter in a study, but seldom in real life. So that's why the REFLOW study is so important, because this is one of the first DCBs which were really evaluated in complex tasks C and D lesions, so longer lesions, which are at higher risk of restenosis, also according to the FDA definition, and are normally not included in clinical trials, but are the patients which we encounter in real life on a daily basis in our practice. So in the REFLOW study, patients were included with both claudications and critical limb ischemia. The Rutherford classification ranged from 2 to 5. The majority of the patients, 67%, were Rutherford 3, meaning severe claudication. The mean age was 71 years old. Many of the lesions, up to 67% of them, were calcified. Again, very challenging, with almost 50% of occlusions and a mean lesion length of around 22 centimeters. The 1-year primary patency rate was 71%, and we found no difference in the patients treated who had an occlusion versus stenosis. This is an important point. The freedom of TLR, which is more a clinical endpoint, was 80% at 1 year, and the survival rate was 95%. There were 6 deaths, but none of them were procedure or device related. And the 1-year results have been published in the Journal of Cardiovascular Surgery, 2020. We already compared the 1-year data with drug-eluting stents, which have been tested in those challenging lesions. And we still need to remember that the golden standard for those lesions is bypass surgery. And when we looked at the 1-year results, we saw that the LEGFLOW balloon gave us similar results than bypass surgery and drug-eluting stents. And it's very important now to see if after 2 years, the sustained effect of the LEGFLOW is still there, both in terms of clinical endpoint, looking at improvement in Rutherford classification, but also comparing it to the data we have with 2-year follow-up, for example, on drug-eluting stents or bypass surgery in those lesions. So the LEGFLOW is a drug-coated balloon, and it's available in 0.035, 0.018, and 0.014 platforms. That means you can use it from the groin until the foot. All platforms have a doses of paclitaxel of 3 microgram per square millimeter. But the big difference between all the other DCBs on the market is the unique coating technology called SafePax. So the SafePax technology coating has the lowest washout of rate compared to the rest of the DCBs available on the market. This not only provides you a safer procedure, so you have no washout and possible embolization of the paclitaxel, but guarantees also delivery of the biggest part of the doses on the balloon into the lesion, which is, of course, a big challenge if you treat long calcified occluded lesions. So this coating matrix is patented by Cardionovum GmbH, a German company with headquarters in Bonn, specialized in manufacturing innovative drug coating technologies, including DCBs and drug-eluting stents. And Cardionovum's research and development team has been part of the evolution of drug-coated balloon technology now for the last 15 years. So they have a huge experience in that field.